Thanks, Amy. So I'm Lucy Knightley. I'm from Gateshead Health. So I'll just talk to you about a little bit of a project that I kind of started, which wasn't intentional, and a bit of a journey that we went on to get there. So a bit of a background is obviously how the NHS has ended up in the state that we're in with disposable equipment is VCJD kind of turned the NHS on back on its head well before my date, when we had to go get rid of everything that was reusable and go to single-use items for the risk. And that kind of led us to all of this single-use plastics that we used
I
to
have to
now
say,
for
always, when it's your
laparoscopic
first baby, I
surgery.
have to say, unfortunately, the midwives are a bit dismissive in the
Sorry,
sense.
can we just ask everyone to mute?
In the
Thank you.
NHS, disposable instruments are about 20 to 30% of all waste. And obviously, we're well aware that the NHS has got to have a net zero by 2045 and a reduction of 80% of the CO2 by 2028. And I think for me, it was actually the price that actually £10 billion annually we spend on just disposable income. Just use it once, chuck it in the bin. And that was actually quite shocking when we discovered this retrospectively. Obviously, like most hospitals, COVID gave us a massive supply issue when we were turning up to do surgery and basic instruments were just not available. So we had a goal to introduce as much laparoscopic device as we can. And the requirement was, in the end, was to have one tray. How we started it, a little bit of I can't go backwards. One of the surgeons come and said, we need to have a better bipolar device in gynae. The Robies were continuously off for repair, and bipolar forceps, the one that we were using, was constantly out of stock because of COVID. So obviously we went backwards, went to market to find out what there was. And we've done a full market research and we found a company that could provide us with a reusable bipolar that we had tried. And we put that into trial as we did it. So this is what we kind of come across with. Some of the feedback was the weight, the ergonomics, the insertion of it, fixation, and there was satisfaction on it as we come through, as these are some of the feedbacks that we'd got through. But most of all, the equipment worked, and it worked better than the disposable option that was available. And as a result of this, we got a trial tray, and in that it had every surgeon's dream of equipment that they could want. So we basically said to the company, can we make it our own? Like, what does it look like if we want it? And it was basically whatever we desired. We could create a tray that was completely reusable, designed specifically for what we needed and nothing else. It wasn't anything that the company wanted us to have. So on our trays, we had, I think it's on the picture before, was we had all of our graspers, scissors, bipolar, Spackmans, Sims, Fulcellums, like everything that you could potentially need to get in and out of any gynae laparoscopic procedure, from total hysterectomy, even just to your basic diagnostics, everything was on there. Even it includes a reusable L hook. So we were getting rid of everything. So for gynae, we introduced it at phase 1. And gynae is quite small in our hospital. It doesn't equate to a lot of the equipment that we use on a substantial amount. We rolled it out and we were using it for about 2 years in gynae, and every year this is the amount of items disposable that we stopped using, which was 1,153 solely just for gynae. We then hit a second wave of procurement issues, and our gen surgeons had no L hooks to do lap choles. And we were like, actually, gynae, you've got a tray that you can use. Let's have a little look at it. So then Gen Surge looked at me like, actually, can we have one of these trays? And what does it look like for us? Do we have to have the same? So then we came across with a separate tray for general surgery, and they got to pick exactly the same as whatever they wanted on theirs, including the L hook. They've got reusable ligger clips on theirs, the same, and in and out.
Sorry, Lucy, can you unmute? That was
I don't know how that muted then. So we designed it that way. All of a sudden, our gynae-oncology surgeons were like, can I have a little look at this tray? Because obviously the Robies were starting to break for them as well, and they were going back to trying to find a disposable bipolar. So we changed the tray again to accommodate gynae-oncology. So the original tray that gynae used is now a gynae and a gynae-oncology tray, and we just added a couple of instruments. We put on peatlins, and we changed the scissors, we changed the graspers for them just to make them a little bit heavier. And now all of our surgeons are using this. So we're kind of at the stage 2/3. We're just about to introduce reusable trocars. So they've just been signed off. I think the order will be going in for them. So you'll get to use them, Amy, when you come to us shortly. So we'll be putting reusable trocars onto the tray. So everything in the department we only really have now is staplers for colorectal surgery. That is disposable and plastic. Everything else we've gone to is a fully reusable system. So that's the waste. And then we kind of come back, and this is our savings. So when we kind of look at where we were and what we were saving, in year one, I think it was £54,000 alone just for gynae surgery that we saved. And that wasn't the intention, was to save money. We kind of just wanted to get over all the procurement issues. And that's how I said it's a project that wasn't intended to be. We were just trying to solve a stock crisis that we had. We wanted to keep operating. And we've gone from using 6,225 instruments per year to 18, but the 18 is a little bit misleading. That's just replaceable parts out of the trays. So that could just be a sheath that's being replaced, or a scissor tip, or an L hook in all of this time. So our sustainability is absolutely increased massively in the department. So these are the phases in savings. So gynae was 53,000. Phase 2, when we introduced Gen Surge, was 144,000. Phase 3, we're going to have an increase of a further additional saving of £100,000 when we bring the trocars in. And why I've put phase 4 as a full rollout is because we're not going to make everybody use the trocars straight away, because we know it's going to be a bit of an adjustment period. So what we're asking for in these figures, phase 4 is only based on 70% of uptake. And that what we're including is a full. You'll still want an optiport to go in sometimes, and you'll still need some variances depending on patients. So we're not completely getting rid of that option. It's going to be surgeon dread or clinician dread on it. But initially what we've said to the surgeons is, if you can use at least like a fourth or like 3/4 of what you're using on your ports to get used to them initially. And that's phase 3. Phase 4 is obviously everybody ideally using them and keeping a small supply for just those emergency ones, or ones where you use an optiport and you want to have visibility going in. Some people like to have use an optiport for the 12s. We're not removing that. They'll all still stay the same. So our predicted full saving, once we get to a full thing, will be 381,000. And I think we worked it out over a 5-year period. If we go backwards to when we introduced gynae, it's just short of £1 million, like £5 million saving that we would have over a period of time going through, which is astronomical in the current climate. Also, we've had a little bit of efficiency in that prep time for the theatre staff. So setting up a theatre list, like you'll probably not be aware of it, but a lot of time and resource goes into getting all of the equipment out. So a list could take us somewhere 50 minutes to an hour, depending on how many cases were on a list. Now the staff have to lift up one tray. They lift up one tray, has 90% of the equipment in it, a pack and a couple of supplementaries at the moment, which are your ports and your sutures. That'll go down to a pack, a tray, and your sutures, and everything will be on the trays that you need. It also gives a little bit of confidence. So if you turn up at 2 o'clock in the morning and you haven't got your usual gynae team that's there waiting for you, the emergency team that's on knows exactly what's needed, because there's nothing else available. Everything's on the one tray. So you're guaranteed to have the same equipment over and over again. So that improves our readiness. Logistics, our logistics team, they've saved a lot of time. We've saved one whole manpower in time in just counting and restocking items that no longer need to be on them, and no back order equipment. Some of the other efficiency on this is these are maintained trays, so they're loaned from the company. Every 20 uses they go away and they're fully serviced, so they're constantly maintained, sharpened, replaced. any issues with them, we send them off, they're turned around within 72 hours and they're brought back to us. So we've got that constant assurance that if you turn up, your scissors are never going to be blunt. Your L hook's always going to be present on it. We're never going to lose anything. Your cables are never going to be missing or AWOL. So for us from a theatre team, no one said to us, these scissors are useless, like these need to go away and get sharpened, because that's just done automatically now. And that's an expectation that we've got right the way across the department. So this is our sustainability Gateshead. So it's obviously 6,225 instruments. We've saved 723 kilos of waste going off to landfill, which is amazing considering how the NHS has changed the way we don't burn our rubbish anymore. So it does end up in some form of radiated landfill now. I think especially up in the northeast it does. 3,000 trocars we will save putting in. That's another 390 kilos. And we are aligned with the NHS net zero goals as well in the Green Theatre Plan. So kind of a big unintentional win. It wasn't how we set up to do it. We just started this program because we kept running out of equipment, and we just rolled and rolled and rolled with it, and kind of found ourselves in this little loop of going, oh, have you seen what we've achieved today? Have you seen the new figures that's come out as we've dug our way through it? So we have been to BADS, and we did put the poster up at BADS, which I'll quite share with us. And we have been nominated for a HSJ Partnership Award as well for it towards net zero. So here's our little conclusions and some references. I'm happy to share and take any questions.